them anyway, following the emergence of the Omicron variant. Mask wearing is now compulsory on public transport and in shops, but strangely not in pubs or schools. The government says it needs 3 weeks till scientists can really look at the variant and see what dangers it poses, and then we'll all be a bit clearer. Has to be said that many people have got used to not wearing masks, so it remains to be seen how enforceable this will be. The BBC spoke to commuters at Manchester Piccadilly Station.
I would put it at about a quarter of the people that were on the bus. I worked all the way through the lockdowns, and during the first lockdown it was a case of I would pull people up on it, and it just got to a point that people would threaten violence because they didn't want to wear a mask. And if people feel that strongly about it, there's not really much anyone can do.
Do you think the worries about the new variant may change people's behaviour though?
It depends, because at the end of the day it's not taken hold yet. So once something takes hold, that's when you see people's mindset changing. Until it actually happens, there's not really much you can do.
I'm not happy with it, to be honest, because the mask is not 100% protecting. So,
but the idea is it cuts the risk of you spreading it to somebody else.
to be honest, I have vaccine. Yeah, if everybody have vaccine, maybe not need to be wear everybody mask.
You just got the bus in. How many people were actually wearing masks?
Very few people, and I think that's the problem. I've lost loved ones through this virus. This with the fact that there's a new variant now in another form of COVID, so it's like the spread is the virus is still going to continue to spread because people are not adhering to instruction. So very few of us wore the mask this morning, and the way the people look at us is like, what are they wearing the masks for?
Just the fact that they've changed the law, is that going to influence your behaviour?
Honestly? Possibly. I'm not sure yet. We'll just see how it goes.
That doesn't sound like it will necessarily.
No, well, I probably will at the start, but again, if no one else is, then I probably won't.
So interesting, isn't it? That just that once people have decided not to wear the masks anymore, it's very hard to get them to put them back on. Government has put its faith as ever in the vaccination programme. From today, all adults over 18 can get the booster. So not just the over 40s, all the over 18s. And you can get one 3 months after your second vaccination rather than 6 months. The vaccines may not be as effective against the new variant, but a booster jab increases people's antibodies to make up for any shortfall, hopefully. Yesterday, the Health Secretary Sajid Javid was talking to the Sky News correspondent John Craig, and he told Mr. Javid he hadn't yet had his booster. So the Health Secretary said, "Come with me."
Have you got boosted yet?
No, I'm 64 and I've still not had it.
You haven't? Why not?
Well, partly because I got COVID at the Hartlepool by-election.
You should be okay now.
And so I didn't have my second till the 14th of June. So under the 6-month rule, that takes the 14th of December.
But under the new rule, you'll be okay.
Yeah, exactly.
You come back here later this week.
Yeah. What time do they open here?
They open till 8, I think. Oh, in fact, they might give it to you now if you walk in.
You think so?
Yeah.
I'm going back to work there.
No, do it. Can you make me a promise?
Sorry?
Make me a promise. Just go do it now.
See,
go on. Bonus. No, just I'll tell the office. Tell them. Do you want me to go with you?
Can I go and get my tab?
Yeah, come on. I'll walk in with you. Come on.
What about this? Amazing. So the Health Secretary saying to John Craig, "Look, I'll walk you in and you can get your booster." It hasn't been like that for everyone, though. We're going to talk to journalist Nina Mishkov now. Your husband would love to have that encounter, Nina.
Well, absolutely. And I might just say happily unmarried.
So, of course, your partner with Grant.
A fine distinction. But anyway, no, because he had COVID in January, he got his doses later than usual. The 6 months for him is up on the 4th of December. So a few weeks ago, when the government were saying and the media were publicising it that it could be cut down to 5 months, he tried and has tried, went to our medical centre, went to a pop-up place, walked around to the medical centre in Kentish Town near us where he got his flu jab, and they all said you can't get it until December the 4th because the computer system is geared up for 6 months and we can't change, and it can't be changed. And so all these, he's been trying now for 3 weeks, and hopefully he'll get it soon. I mean, but he's gone online, he's phoned, etc., etc., etc. It may be different, in the next day or two. But it's been a real struggle.
But it seems odd. So he's trying to get it before the 6 months moment, is he? Or
yeah.
But he should be able to, you think?
Well, he should be able to now.
Right.
He's gone online just now, and he's been offered the 6th or the 7th, which isn't so bad. But it's been taken every day. He's been trying, and it's just, we're in central London, for God's sake. It's not like we've got to drive 30 miles to the nearest pop-up.
Is your take on it that it was incredibly well organised at the start, but then it drifted?
Absolutely. I think that's exactly what happened. At the start, we, for instance, went round to our local medical centre, and next door there's a gym, and they've taken over the hall, and it was a very efficiently run. This time, our medical centre has had nothing to do with this other than fielding questions. And I was sent for my booster to the place in Kentish Town, and that was all fine for me. I can walk another half an hour, that's fine. But people can't sometimes. And I think the problem is there hasn't been a really proper orchestrated campaign with somebody that you trust, obviously not Boris Johnson, who would trust him, somebody that you trust standing up and saying, look, it's not just it would be a good thing to have the booster. You really need it because your immunity wanes with each week, each month after you've had your dose. This is part of the dose. We're going to have to face up to it. And then perhaps something else in another 6 months' time, because that's the way it is.
Thank you very much, Nina Mishkov. Sorry, Nina, I'm going to press on, but thank you. Talking about Grant, her partner, and how he can't get the booster, but then he was just before the 6-month period. Do you have faith that the government can deliver the booster rollout at this scale? Vine at bbc.co.uk. You can text us or message us via WhatsApp. Let's talk first to Professor Anthony Harnden, who's Deputy Chairman of the Joint Committee on Vaccination and Immunisation, JCVI. Interesting to hear Nina Mishkov, saying that it started well and then it just seemed to become disorganised, Professor.
Yeah, well, of course, as Deputy Chair of JCVI, I'm responsible for help designing the vaccine programme, not for the operational side of it. But there are a couple of important points. One is that whilst we've recommended that the length of time interval between the second dose and the booster be reduced to 3 months and that the age range widens, we have clearly said that we need to work down in priority order according to age, because it's those older people that are most at risk. So, the Secretary of State is absolutely right in getting a 64-year-old in to get his booster. What we don't want to do is lots of 18 to 30-year-olds ringing up now because they had their second vaccination more than 3 months ago, wanting a booster. We need to work down according to age. Otherwise, we just won't be able to deliver the programme to those that are most at risk. So that's a really, really important point.
I understand why you say that, but it sounds, if you're a 19-year-old listening to the news, your impression is that you can have the booster now, as long as it's 3 months or more since your second jab, and you get on with booking it.
That's not what I've been saying. I've been absolutely clear on the airwaves to say that we must move down in priority order. And so what we don't want to do is open the floodgates, because the systems just won't cope with it. So it's really important that we work. We will move rapidly down to those younger age groups, but at the moment we're still making sure that we get boosters. We've only delivered 14 million boosters in this country to date. I think it's a little bit more than that now. But there's 56 million adults in the UK, and we've got a lot of boosters to get through before we get down to the younger age groups.
In terms of first and second jabs, you're on over 50 million, aren't you?
Yeah, no.
So you've done well with that, but it's just this comes back to Nina's point. It seems to almost be gone off at half cock, the booster campaign.
Well, as I said, Jeremy, I'm not the operational lead for the NHS. I think.
No, I understand, but you're watching it more carefully than us. I think
we're quite aware that the uptake of boosters hasn't been quite as smooth or as good as the initial campaign, and therefore we really want to accelerate it. And so therefore we've implored on the NHS to really try and accelerate this booster program and to make it as simple as possible. Now, I don't speak for operations, but I know there are operational difficulties in changing the national booking system and things. So it may take a few days before this completely beds down, but I've got every confidence that the NHS will be able to deliver this.
All right. Just to help me understand the science here. I know that you gave advice when it came to pushing ahead with COVID jabs for 12 to 15-year-olds, and your advice was the benefit is too small. And the government essentially overruled that. Is this another one where the government has overruled you?
No, absolutely not. No, we've been quite clear that the data from this, looking at the genomic sequencing of this particular variant, is of concern. There are a number of mutations on the spike protein which lead us to believe that it not only might not respond as well to the vaccines, but it also may be more transmissible. So yes, it is of concern. What we don't know is how much disease severity, that's hospitalizations and deaths, that the variant will cause. But what we do know from laboratory studies is that if you have high circulating antibody levels, either through natural infection or through vaccine-induced immunity, then it will help fight the variant, even if the vaccines aren't completely tailored to the variant.
That's the bit I can't grasp, because you said that you don't know whether it defeats the vaccine, but your answer is to vaccinate more people. And I don't see how one follows the other.
Well, it's quite clear. We don't know how much vaccine escape are. If you want to get that into technicalities, 3 of the 4 antibody receptor bits of the virus are different to the original strain, but there's still one that is similar. So we expect that high neutralizing antibodies to the wild variant, that's the Wuhan strain, which is what vaccines are based on, will give a degree of immunity to the variant. But also, as well as antibodies, we need T cells, which are the cellular way that we fight off the infection, and all indications are that cellular immunity from the vaccines will be useful as well.
Because there was a piece in the Daily Mail you may think is a bit irresponsible, but essentially they're saying the Omicron variant is a sign the vaccine is basically in its last gasp. That this is it's mutated in a way that was almost unrecognizable from its wild origins, as you call them, and it's now posing much less danger, and yet we're all panicking.
Well, that I say we don't know, Jeremy. We may. I mean, I don't think we should panic. I think we should be concerned, but it may be that this variant causes a more mild disease. But we will know that over the next few weeks. So it does seem sensible, do you not think, until we know that, to accelerate the booster program, which we were going to do, we were going to boost everybody anyway. So accelerate it and make sure that we have the most population immunity that we can do to fight off the variant, should it be causing more severe disease. But we just don't know that at the moment.
Thank you very much for your time, Professor Anthony Harnden, who's Deputy Chairman of the JCVI, the Joint Committee on Vaccination and Immunisation. Listening to that is Dr. Bharat Pankhania, who is Senior Clinical Lecturer at Exeter College of Medicine and was involved in pandemic planning with Public Health England, so right at the start. Dr. Pankhania, are we able to deliver this booster, do you think?
Yes, of course we are. And before I go down that road, answering your question, I must say I agree with all that the Deputy Chair of JCVI was saying, very much so. So in answering your question, can we deliver? Of course we can. The big issue, the fly in the ointment, is who is best placed to deliver this. And I say emphatically, primary care, community pharmacy services. They're there, they're in the community, they know what they're doing, they've done this job before, and they deliver it at great value to the nation. And really, we must invest in enabling primary care to do this, because I think going down the road 6 months, 9 months, 12 months from now, we may need more and more vaccines, etc. So it's better to invest in existing systems, augment them, and allow them to become slick operational machines.
All right. Well, they were slick at the start. And then Nina was saying, who we had on, I'm sure you heard her, our guest was saying that it seems to have slowed down. It may be the public. A lot of people have thought they've had jab 1 and jab 2, and they're not really fussed about the booster.
No, so let's address the bit about they were slick at the beginning. So this was run by primary care, and it was a super slick operation. Thereafter, when it came to the boosters, primary care were not involved in it. And hence we see it's been a bit of a stop-start and difficulty getting the vaccines. And therefore, I am emphasizing, please put primary care, community pharmacies at the head of this booster delivery program, and you will see that they do a good job. But we need to invest in them and allow them to do it properly.
Yeah, I understand that, and you've said that. I'm just, do you worry though that the public have for whatever reason drifted a little bit from the central thought that they need to get the first jab, the second jab, and the booster? Does it need some sort of information campaign here or something?
Oh, absolutely, absolutely. And the mixed messaging is regrettable, because what needs to be said, and said very clearly, is this: we immunize you, it protects you. Unfortunately, your immune response starts to decline after a few months. When your immune system is super primed with the booster, even if you have a variant like Omicron, it will be effective against it. And that message has to be given out succinctly, clearly, that the boosters will protect you, especially when we have rogue variants around.
Just one more for you, if I can. I'm assuming at some point they will bring out a new variant vaccine to deal with COVID as it's mutated. But is there any sign of that? And if I can I just ask, how easy is it to hit a moving target anyway?
Easy. Happy to answer that. So let me answer the easy bit first, okay? So if we have to reformulate the vaccines, of course we can do it. It would take about 3 months from start to finish, because we've got to reformulate it, test it, make sure it works, make sure it's safe, put it into the bottles. So we can do it. The big question is this: should we do it? Well, the answer is, once we find out how much vaccine escape the new variant is, we can make the decision that we want to reformulate it. Having reformulated it, we're back to square one, happy days, but it takes at least 3 months to get back to delivering the modified, refashioned vaccine.
Thank you. That's fascinating. Dr. Bharat Pankania, Senior Clinical Lecturer at Exeter College of Medicine, who's very involved in planning for the pandemic in the early stages. Ed Sheeran now.